is something going on that you may have heard about it. It's the COVID-19 virus that's spreading across the country. In fact, the Surgeon General, Jerome Adams, says that we might be in for the worst of the worst within the next week or so. And this is something to be very concerned about, regardless of who you are, where you stay. But if you are a black person, when I say black, I mean somebody coming from a social-economic background of a typical black person, right? Black people in America, black Americans, not Joy Reid, not Kamala Harris, black. I'm talking about black like me. Black, born in D.C., mama from New York, father from, D.C., like that type black, okay? I'm just telling you because it's in the data, guys. What are you talking about, Tim? Like, well, if you are black American, you're at a higher risk for COVID-19. You are more susceptible than others. Now, there's social economic reasons for it. There are reasons of logistics. But the reality is what it is. Now, maybe you heard earlier, or formerly a couple days ago, a week ago, there was a rumor going around that black people couldn't catch COVID-19. That somehow the pigmentation of your skin, the melanin in your skin would protect you from COVID-19. This was a rumor peddled by people who want to kill you. Probably started on one of them Stormfront sites or one of those 4chan or 8chan sites. I don't know. The dark web. I don't know. But it's bullshit. What we're seeing now is a concentrated number of deaths and cases in the black community. Numerous entities are reporting on it. It's a reality. F what you heard. Get in the house. Stay in the house. Underlying medical conditions. Having to go to work due to just not having the resources to stay home like some others. In my own life, guys, presently, I have two brothers, one by blood, one by love, the other by blood. I have three brothers in total, actually. And two of those brothers every day have to go out to work. I'm afraid for them. I'm afraid for them because they have to do that. They're putting themselves in harm's way because they need the money. I'm fortunate that my job allows me to stay home. What I do, my career, my business, is at home, in the safety of my home. Their risk of contaminating COVID-19 is so much higher. It's just economics. So I want to stress to everyone out there to be aware of your situation. Maybe it's time to consider what's more important, because keeping that bill paid while you wait on the Trump check, it might not come in time, but what might come before that Trump check is COVID-19, and the survival rate of black people is a lot lower. To that point, here goes a clip. CBS's Norah O'Donnell talks about it.
Tonight, with the rate of infection increasing in cities across America, there are alarming new statistics showing the pandemic is taking an especially heavy toll on minority communities. In Illinois alone, more than 40% of those who have died are African Americans, even though only 15% of the population is black. Adriana Diaz has more on these disturbing disparities.
In the age of coronavirus, funeral home doors are disinfected, while inside, services are led under a mask.
Death has no respect of age. It has no respect of color.
Today, Anthony Smith of Detroit was remembered, the first known mail handler to die from the virus. His co-worker, Brittany Crumpton.
I don't want to go back to work because I'm have anxiety about it really bad.
Another public worker, Detroit bus driver Jason Hargrove, succumbed to the virus days after complaining about a woman coughing openly on his bus.
Man, y'all need to take this serious. It's folks dying.
Their cases are part of a grim trend. African Americans account for 41% of COVID deaths in Michigan, though only 14% of residents. In Chicago, Black residents represent 72% of deaths, but just 30% of the population.
Those numbers take your breath away.
Chicago Mayor Lori Lightfoot.
The distribution of this disease tells a story about resources and inequality.
Dr. Monica Peak studies health disparities at the University of Chicago Medicine. She says African Americans are more likely to have underlying conditions and still be working.
When the city puts out orders for people to shelter in place, the grocery stores are open, the public transit is still open, and the people that are working in those jobs are disproportionately racial and ethnic minorities.
Dr. Peak says both race and socioeconomic status are contributing to this trend. But since testing hasn't been comprehensive, public health officials warn that the real proportion of people of color being affected is likely higher. Nora?
All right, Adriana, thank you.
In Milwaukee, the coronavirus, based on all the data, shows that it entered that state in Milwaukee in an affluent suburb. But then the virus spread to and took hold and erupted in a black community. As the public health officials watched cases rise in March, too many in the community shrugged off warnings with rumors of conspiracy theories proliferated on social media, pushing the bogus idea that black people are somehow immune to the disease. I want to also point out how I haven't seen a single Democrat operative come out and talk about, blame Russia for that lie. Is it possible that there are bots being employed to spread a lie in order to try to erase black people out of communities? I mean, who started this idea that black people can catch COVID-19? I mean, they'll say that the Russians try to steal our elections, but no one's talking about killing black people with this disease, this virus. I mean, I didn't hear any other nationality make that claim. Why was it black people that were pinpointed with this misleading information? And did Facebook and Twitter go as resiliently and as strategically to erase the post reciting this BS conspiracy theory? What if people believed it? What if it attributed to some of these cases that we're seeing? I'm just saying, I just remember everyone was up in arms how Zuckerberg and Twitter guy, they weren't doing enough to stop people from calling Hillary Clinton a sellout or lock her up. But I didn't hear anything about this lie that's now costing lives. I think it contributed to it, and I didn't hear any pushback. And I have yet to hear. This is the first show, me speaking it, that I've heard it even uttered. As of Friday morning, African Americans make up almost half of Milwaukee County's 945 cases and 81 of its 27 deaths in a county whose population is 26% black. So you're 26% of the community, but you make up 81% of the deaths. Okay? You get it? It's like 3 times. Almost 3 times. As in most things that are horrible. You know, there's a saying in the black community, when white people get the cold, black people get the flu. I just want to remind all those people who love to point out, love to say, one day America's going to fall. One day white people going to get what's coming to them. You forget you live with them. And you forget you're on the bottom of the rung. And you forget when they fall, you fall first. That's how it's always been in this country. Now, poor people will go, but black people are predominantly the poor people. Get it? So, though it's social economical, just so happens, by happenstance, that black people are the poorest. Just amazing. There are people that come across that border who somehow end up more affluent. Because when it comes to jobs, when it comes to hiring practices, those employers would rather hire Latinos because they're a little bit lighter than hire black people. Now, you could say it's because they pull his pants hanging down off his butt. You can say that if you want to. Everybody don't wear the pants hanging down. Everybody ain't blasting NWA, okay? It's a problem we have in this country. It's systemic, and nowhere is it more prevalent than in the COVID-19. COVID-19. 40% of the cases, black, 13% of the population. Why is that? Now, you answer that question for me. In Michigan, where the state's population is 14% black, African Americans make up 35% of the cases and 40% of the deaths as of Friday morning. Detroit, where a majority of residents are black, has emerged as a hotspot with the high death total, as has New Orleans. Louisiana has not published cases breakdowns by race, but 40% of the state's deaths have happened in Orleans Parish. And Orleans Parish is predominantly black. Illinois and North Carolina are two of the few areas publishing statistics on the COVID-19 cases by race, and other data shows a disproportionate number of African Americans were infected. So that's the reality. That's what's happening, guys. I will try to keep you up to date, and that's why I send out a message to all folks to pay attention, to recognize what's happening. We're about to see the worst week. And for the Trump administration to come out and say this after people were tamping down on the severity of what we could see, and now for them to be, I saw Donald Trump with a very solemn look on his face. His eyes were no longer dancing. He was uniquely lucid. And he said that we need to be very much aware that this is going to get horrible. So, those frontline workers, those essential workers who are so essential, they can't even get health care. Those essential workers are so essential, we can't even give them the proper personal equipment. They're going to be our first fatalities, if not already. So, if you can go home, go home. If they're halting evictions, there's worse things than the owe money, okay? Stay home. Hey, Moose. Stay home. All right.